We have doubled the number of confirmed cases every night. We went from 13 yesterday to 26 today. Butler County and Franklin County are the closest. Most of the cases have been up in Cuyahoga, up around Cleveland. We want education, not fear. There's been plenty of fear on Facebook, and that's the whole point of today, is to start to combat that fear, to give people the tools and the education they need to make good decisions moving forward. So Jared will elaborate on some other stuff. We do have one unconfirmed case in Greenfield, come out of Greenfield schools. The testing should be back by the 18th.
We're hoping by Wednesday.
By Wednesday, we should have a yes or no on whether this is confirmed or unconfirmed. To give you an idea of breadth of the problem, we had to make 162 phone calls today to notify individuals that that person had come in contact with. Once again, education is the hallmark. We don't want people being scared of this. We want them to be willing to come forward and say, hey, I may have this. So we're stressing the big things that you've already heard about: the wash your hands, cover your cough, the social distancing. If you don't need to be in a public place, don't, for lack of better terms. Also, one of the bullet points we're wanting to push is more, that's the word I'm looking for, self-responsibility, personal responsibility. If you think you might have been in a situation where you've come in contact with a person, you're showing signs or symptoms, self-quarantine yourself. I mean, until this has run its duration, maybe we stay away from elderly family members. I mean, we stay away from those high-risk groups of the very young, the very old, or the immunosuppressed. Okay? The biggest thing, if you're sick, stay home. We can't stress that enough. If you're sick, stay home. You've seen a lot of the graphics out of CDC and everything else where we talk about flattening the curve. We don't want that big spike of cases, because that overwhelms everybody's resources, from us, the health department, the local hospitals, everything else. So this education, it allows us to slow the spread, because they're projecting 60%, Jared?
Mm-hmm.
They're projecting a 60% infection rate statewide. And so it's not a matter of if, it's a matter of when. We see it here. Some tools that we're having available to us: please watch social media, watch the Department of Health's page, watch Paint Creek's page, watch City of Hillsborough, City of Greenfield. We're going to push that information as fast and as hard as we can. We're trying to be as transparent as possible. Some other options, through the Highland County EMA, there's an application called Code Red. It can be downloaded for free from the App Store or from the Google Play Store. And then you have to register the app, and then what that allows you to do, you will get real-time updates as we start to push data. Like you've seen the Amber Alerts and stuff like that that pop up on your phone. You will get an alert similar to that if we deem it necessary to push that data via Code Red. Okay, so, but it doesn't work unless people register for the app. So getting that information out there, getting the app downloaded, and getting registered for this area allows us to use that tool. One of the biggest things, and this was brought to me late, and we've seen this at Highland District, we've seen it some with Adina. If you are not symptomatic, you do not need to be tested. Okay? We've had some individuals reporting to the ER and short of demanding that they be tested. Our supplies are limited. We test who we deem necessary to test. I repeat that, if you're not symptomatic, you do not need to be tested. Okay?
3 functions: the emergency management, the public health, and the public information sector. And as of 8 o'clock this morning, we upgraded. We're still at partial activation, which is Monday through Friday, 8 to 5, unless we need to change that, but that's where we're starting at. And we're using ESF4, which is fire and EMS, ESF5, which is emergency management, ESF8, which is health and medical, and ESF15, which is public information and logistics. I'm sorry, ESF7 also logistics. So that's what's open at Highland County Emergency Operations Center at this time.
We're working with all the fire or EMS departments here in the county, trying to make sure that we have as sufficient a supply of personal protective equipment for the responders to try to minimize our exposure and transmission of this. I've met with most of the fire departments here in the county earlier today and have a list of what PPE they have. Where Paint Creek itself is actively working to make sure our staff are spun up on the means to address any potential patients, kind of how we're going to address them, transports, working with Highland District Hospital, Adina and Greenfield as well, and their policies and procedures on transport and receiving of patients, and how to keep the services at the level that we currently provide, as far as having 5 ALS equipped ambulances throughout the district, trying to make sure we keep those staffed. And obviously concerns if we infect 60%, obviously our staff is going to be affected just like yours. So how do we manage it? Looking at continuity of operations. So those are some big things we're currently working on, as well as trying to make sure we have enough disinfectant supplies and EMS supplies to manage the upcoming probably couple of months, at least the way it sounds, until this thing kind of works its way through. We certainly hope it isn't as bad as it's projected, and the process goes rather quickly and we can kind of move on, but we're trying to be as prepared and ready to go as we possibly can be.
We've really identified 3 different areas that we're focusing on in the county-wide response. The first is to really measure local impact. We've got systems in place that allow us to measure hospital ED admissions and hospital admissions. So we're looking for increases in fever cases, we're looking for increases in respiratory cases, so we're trying to identify when's our community really going to see the impact of this, in addition to doing local testing to try to identify when we have local cases. So we're watching for when it's going to arrive. We're also trying to slow things down. As we talked about earlier, we're trying to flatten that epi curve. And that's not just to protect people from the virus, but that's also to protect our healthcare system. So that's our second point, is we're trying to slow things down and protect that healthcare system. And the third thing is we're really trying to protect those high-risk groups. The information we've got available to us now really points us towards those high-risk groups, ages 60 and older with underlying health conditions, as being the most highly impacted by this illness. And we need to start really positioning ourselves as a county for a long-term impact of this. I heard a really good analogy the other day that this is not going to be a weekend blizzard where the snow melts and we're back to normal next week. We really need to start thinking about several months worth of effort and planning and trying the best we can to protect those high-risk groups and allow our healthcare system to respond to the illness as it works its way through our community. And that's, if we have that opportunity, that's where I really think we need to focus, not only as individual spokesmen of our agencies, but as local media. We have a person that we're sending tests up for now. We've had others in the county that you guys have not known about, but the real focus here is at some point we're going to have local cases, and we really need to start focusing more on how are we going to protect on high risk, protect our healthcare system, and not worry so much about who's getting tested when and where and what's happening right now. It's going to happen one way or the other, and that's the way we need to lean forward. So we're going to be working through our existing plans in Emergency Operations Center and do as much as we can to prepare the county for this, because we're in that really kind of weird place where right now the skies are blue, but we know on the horizon the hurricane's headed our way. So in some cases people feel like this is overkill or overreach. And looking at what's happened in other countries and other states in the nation, we know that there's a significant impact headed our direction. So we're doing what we can to prepare for it and to be calm about it and to encourage our citizens to do what they can to prepare.
First of all, I want to say thank you to all you guys for the work in this matter. There's a lot of behind the scenes like you guys mentioned, but that's really, I feel like you've done a lot to kind of stop this thing. We know it's not, we know we can't stop it, but what I'm saying is, with the fact of contacting the individuals that may have come in contact, thank you for doing that. From a standpoint of, the village's standpoint, we actually looked at putting some policies in place yesterday internally, and also when we sent out some information as it relates to the citizens paying their water and sewer bills. Now, I realize that we're here today to talk about an individual that was tested, but we believe it's in everyone's best interest that we promote, everyone to be able to pay their sewer and water bills online. And so, we would like for everyone to go to the Greenfield website page, set up to pay your sewer and water bills online. If you would like to ACH your payments, we can send a form to you in the mail, and you can set up an ACH so that payments can be made that way. But we're really trying to limit the amount of exposure that we come in contact with, and then in return, that the public comes in contact with. So the other thing that we're doing as well is we've made the decision to stop visitations in the jail. So, our jail at any point could have 12 to 15 individuals in the jail, but we've made the decision to go ahead and stop visitations at the jail. So if there is information, please understand that we're still working from a village standpoint. We're still working as business as usual, and our police officers are out there working hard every day protecting our village, and we need to keep them healthy and strong as well. So to limit their exposure is a huge benefit, to even our fire department, our EMTs, their exposure too. We would like to see that limited as well, just to protect everyone. But as you look at this 60% potential, it's we've all heard it. It's going to come, and it's not like the county borders. It's not like there's walls. It's not like there's an ocean between the county lines. We all travel a lot of times in these counties, so just be smart about what we do as it relates to the health, and really from Greenfield's standpoint, we're really following the lead of Mr. Warner, and we'll follow the lead of Chief Manning and his crew, and Mr. Bushelman as well. So thank you very much.
So I just want to say, as far as the county goes, I feel like we're in good hands. What I've witnessed today is, of course, we're dealing with a situation none of us has been involved with before, and so we don't have any background, or we don't have any history as to how we go about handling this. But what I've witnessed today is they're very well prepared for whatever comes our way, and that's what they've been working toward. And it gives the appearance to me that they're as prepared as they can be. So I feel like we're in good hands. We've got good leadership, like Todd said. We've all these individuals sitting at the front table, head up their individual departments, and I feel like we're in good hands. So